Well, I've always liked working with my hands. Ever since I was a kid, I was the guy that was taking things apart that I wasn't supposed to and then trying to put them back together. So I've always had an interest in the way things work. And orthopedics allows us to, you have a patient that has a problem, whether it's a fracture or whether it's more of a degenerative condition. And because they've had this injury, they aren't able to do the things that they would like to do, whether it's sports or working in the yard or even just playing with the grandkids. And through what we're able to do with orthopedic surgery, a lot of times we can give that function back to them. And when a patient has a problem like that, it's almost like they lose a little bit of themselves because they aren't able to do the things they once liked to be able to do. So in some respect, we're giving them back a portion of their life and their lifestyle, and that's very rewarding. You know, I like to think of myself as an orthopedic clinician. My job is to evaluate a patient and then suggest treatment options for them. Sometimes those options involve surgery. Most of the time they actually don't. In my clinic, I see 40 to 50 patients a day, and I'll tell you that probably 90% of those patients actually probably end up not having surgery. We always exhaust all non-operative treatments, physical therapy, sometimes injections. And then if the patient meets specific criteria and I feel like there's a reliable surgical treatment option for them, then I'll make that recommendation. It's very important to me that I understand the patient and what exactly is going on with them. Not what the MRI says, not what the x-rays show. I tell my patients all the time, I don't treat MRIs, I don't treat x-rays, I treat people. So tell me what's going on, how is it affecting your daily lifestyle? Being a surgeon, you take on a certain amount of responsibility. And that responsibility is to your patients, and sometimes it seems like I'm always working if you ask my wife. But the time that I do have off, I spend that time, I like to work out, I like to stay in shape. I play with my kids. Most of my hobbies now involve things that my kids like to do. So there's certain things that we like to do, whether it's building Legos or playing sports outside. Those are things that I do to kind of step away from the busy lifestyle of being an orthopedic surgeon.